Visualizing the anterior surface of the crystalline lens is a useful technique because it allows the practitioner to see the quality of the anterior surface of the lens and whether there is any deposition due to, for example, a disease process such as anterior uveitis. In order to conduct this technique, the first thing we need to do is to form a nice clear section of the anterior part of the crystalline lens. This should be formed so that the anterior surface of the crystalline lens is positioned at the centre of the pupil. This is one element of the technique that will ensure that a reduction in pupil size will not interfere with the formation of the reflection. The other related element is to position the observation about 15 degrees away from the midline and then reform the anterior section of the lens on the centre of the cornea. Both these elements will ensure that we form the specular reflection at the centre of the pupil, where the pupil will not obscure the view. We can see here that the illumination system, after going through the cornea, strikes the anterior surface of the crystalline lens and forms a reflection off of the anterior surface with the angle R. What this allows us to do is to examine the anterior surface of the crystalline lens using specular reflection. So what we need to do now is to magnify the image further and always make sure that it is focused and positioned so that the section is in the centre of the pupil. Here we can see what has been achieved so far. We have the anterior lens section in focus, and to the same side as the illumination system, we have the Purkinje image of the anterior lens surface. Once we have achieved this, in order to make the Purkinje image fall in the correct position, what we might need to do is to rotate the observation system, rather than the illumination system, towards the midline, in order to make the Purkinje image lie on top of the section as shown here. Once this is done, we can reduce the brightness of the slit lamp and we can widen the slit further so that we can see a large area of the anterior surface of the lens. This can be further magnified if required, and then the surface can be scanned to examine for any deposition or other disease processes.